All right. So thank you all for coming out and joining us today for this virtual town hall. Obviously things are a little bit different because we have to move everything online. So I appreciate you guys taking the time and meeting with us virtually today. Just to give you guys a little bit of background about everything, I'm sure, or I hope all of you guys got a little bit of background about the assessment, going through the assessment with us and understanding MODA a little bit more, but I'll give you some background on the mini grant opportunity that we'll be hosting. So the Prevention Network has teamed up with the state of Michigan and the CDC to put on a mini grant application for current overdose prevention work being done throughout the state of Michigan. Our goal for this mini grant project is to build the capacity of current overdose prevention work being done. So we're hoping that we can go through the assessments with you guys, which I see all these names and I know that we've done a majority of assessments with all of you people. So I appreciate you guys going through the assessments with us. And that was kind of our first step, was going through the assessments, and now we're on to our second step, which is the grant application. So once you guys finish the assessments, we're going to be opening up the grant application this Friday. So June 12th will be the first day of opening for the first round of grant applications. And this will be an ongoing application. So it'll be open for applications, but we'll be reviewing them 3 times. So once this month, again in July, and then we'll finish off in August for the 3rd time. And we'll be awarding organizations between $1,000 and $40,000 for overdose prevention work being done. So if you guys, like I said, it'll be open on the 12th, June 12th, and it'll be available on our website, which is moda.community, and I'll share that in the chat for you all. And that's where you'll go and create an account through Organizing Together. You'll create an account, and then we'll open up the grant on Friday. You'll go in there, you'll be able to do the grant application through that. It's like a course is what we call them. There's different courses throughout the platform, and that's one of our courses is the mini grant application. So you'll go through there, you'll start filling out the grant application through there, you'll submit it through there, and that'll be open until the 21st for the first round. So that's kind of a little bit of background about everything we're doing and what we're going to be funding. The whole point of this town hall today is for you guys to jump in and ask questions. So I'm going to go ahead and just open the floor to questions for you guys in discussion. Go ahead and just unmute yourselves and just ask any questions you guys have, any statements or anything that you're worried about, so we can get this going and answer your questions, and hopefully you guys can start applying to this grant this week.
This is Jessica. Can you hear me?
Yes, thank you.
Hi, I work with Washtenaw Families Against Narcotics. I was just curious what the total amount available is, the total amount being awarded across organizations, and how many organizations you expect to be funded.
Thank you for asking that. So we don't have a certain capacity of organizations that can apply. So we're not cutting it off like that, but I think the amount that we are looking to spend is around $200,000 to give away. So there is a good opportunity for a decent amount of funding through us. And this funding will go from now until August 31st. So you guys will have until August 31st to spend the money.
August 31st of this year?
Correct.
Okay.
So it's a very fast moving, it'll be a very fast moving process, but we'll be helping you along the way. We'll be here for technical assistance throughout the whole thing, helping you guys figure out how to spend the money, what we can do to get that money spent by August 31st. And so don't feel like you'll be alone in it at all. Once you get that money, we won't just be giving it to you and just letting you, won't just like leaving you blind. We'll help you throughout the way and help you guide you through any of the purchases and worries that you have about spending the money before the end date.
Are there specific restrictions on how the money can be spent?
Yep, so we have an unallowable and an allowable expense list. It's on our website, and I'll share that link right now. And so the unallowable list is it's a hard list of things that you definitely cannot spend the money on. And then our allowable list is ideas. So feel free to pitch other ideas as you're doing the grant application. If you don't see one that fits you, feel free to go ahead and just, submit your own idea. They're all ideas, so they're not 100%, but if you figure out something that's not on that list, go ahead and pitch it to us in your grant application. But like I said, the unallowable list is a set list of things that you definitely cannot spend the money on. So I'll share that with you in the chat. Thank you.
Do you have a preferred focus?
I'm sorry, what was that?
You have a preferred focus for how the grant money is spent?
So, like I said, we're trying to build the capacity of current overdose prevention work being done through research-based practices. So we have 10 research-based practices that we're focusing on. That's through the CDC, something that they outlined. And I can share that document with you all. That's also on our allowable expenses list. So if you go through that allowable expenses list, you'll see a lot of research-based projects like seeking safety, trying to think of other ones, academic detailing. You could do consultancy services to build your capacity of work being done, things like that. So our number one focus is prevention and building your capacity to do research-based projects at your organization.
This is Lisa Foster. This is a very short capacity building opportunity. Can you tell us anything about additional, resources, or is this going to be something that's going to be available after August 31st? I mean, is there a rollout plan for all of this?
Yeah, so this grant was supposed to start in January and it didn't start until April. So that's kind of why things are moving so quickly. We would have had a little bit more time to do things. So it'll be a rolling application, like I said, throughout the months of June, July, and August, but the hard deadline to spend money is by August 31st. So if we can help you find organizations that would be willing to sign contracts and stuff and have everything done by August 31st, and then they could work with you the time after that. Does that make sense? So we'll help you with that and like getting that all set. Like I said, we'll have technical assistance throughout the way, and we've also teamed up with OT Consultancy to help you guys. So we have 2 consultants there. It's Charla and Katie, and they'll both be, you guys can schedule times with them to do technical assistance to help you guys target your organization specifically, so that they'll host a meeting with you guys to go over anything that you're specifically concerned about, technical assistance wise, help you throughout the grant and things like that.
I guess, is there going to be additional funds next fiscal year, or is this just a one-time opportunity?
Right now, it's just a one-time opportunity. We haven't received anything about refunding from the CDC. So right now, it's just until August 31st, correct?
This is Barry. What are the reporting requirements going to be as far as what kind of data are you going to want us to gather? What kind of reports are we going to have to do? What's the timelines? Those are all imperative things when I'm looking at a grant.
Yeah, definitely. I'm actually going to let Louise jump in and answer that, or Amy.
Thank you, Louise.
Hi, everyone. Yeah, I can jump in a little bit. So like Hara said, the funds need to be spent by August 31st. However, we do have a little bit of extra time as far as the reporting goes. So the financial reports need to go to our accountant and be submitted along with receipts. And that does not have to be original receipts. Those can be photocopies, things like that. That is September 10th. And then the narrative report, more of an evaluation. They're going to be a couple questions that are 2 to 3 sentences. It's not a lengthy final report. That narrative is due September 20th. So,
Louise, is there certain data points that you're going to want us to gather specifically? I know it'll be based upon some project, but I'm assuming you want some specific data pieces based upon the focus of what we're trying to do.
That's a great question. And right now, I think we're still in the process of finalizing the final report and specific data points. A lot of it's going to be, how did this increase your capacity and your work in the community, and what are you currently offering in the community? Because I think a lot of this project is also about mapping overdose prevention data. And so it's figuring out what role are you playing in the community? Who are you targeting? What audience? I know we're looking at health disparities and making sure that we're reaching the target population of those in most need. So we'll be asking questions about that. But beyond that, I don't have any specific data points that need to be addressed. It'll be more dependent on what project you're doing and how this mini grant helped you kind of achieve those goals that you set for yourself.
If we identify a gap in a service and we can prove it and have some data to back that up, is that something that would be considered as well when we're looking at the audience aspect?
Definitely, definitely. That would be great. Because at the end of the day, we want to figure out what, and we want to use data to inform our decisions and moving forward in evidence-based best practice. And so we'll help you with that. If you have no idea what I'm talking about right now, we'll definitely help get you there. But if you have any data or needs assessment prior to, that will definitely help your application and the process throughout as well.
Thank you, Louise.
Mm-hmm.
This is Lori from Great Lakes Bay Region FAN. We received a grant last year to have a hidden in plain sight trailer, which is a mobile unit. It looks like a typical teen's bedroom with obvious and not so obvious evidence of drug use. There are other organizations throughout FAN that would like to get one of those. And I know we've been talking about if that's an allowable expense or not. Have you received any further information on that?
I will add Amy to this conversation. So she'll kind of finalize things since she's from the state. I did mention it to her, and I think we were just kind of wondering, is there any evidence behind that those reduce overdose fatalities? Do you guys have anything, or have you guys collected anything or used anything like that to promote it?
I've not looked for the data. We just got our grant last year, and so we had it out in the community probably about 60 times. And you know, shame on me for not doing some pre and post surveys, knowing that this might come up. But I'm new at this too, and so I did not collect any quantitative data. We definitely have a wealth of qualitative things from comments from a variety of community leaders who I'm certain would be willing to write letters of support that they found value in it. People from drug treatment courts, juvenile prevention centers, prevention networks, those types of things. Teachers, counselors. So if we don't have hard data that I've collected. However, I've not done any research to see, because we didn't invent this. They do exist in other places in the country. That's how I heard about it. So I would be happy to do some Googling to see if there exists some of that information, because we find that there was great value in it, and the people who tour it find great value in it. And that's one way that money could be spent quickly, because you can go out and purchase all the stuff.
Yeah.
Because that is a really quick turnaround to get other projects done, you know. But that would be one way that money could be very well spent. So maybe we could just talk offline, and you tell me exactly what you need, and I'll try to find some. There might be evidence out there. It's just.
And Lori, sorry, I'm gonna quick jump in and follow up with that. Is that the hidden in plain sight vehicle or the trailer, was that in partnership with police and NMRE?
Say that again, you cut out a little bit. I heard the police part.
Sorry. Yes, was that in partnership with the Michigan State Police and NMRE, Northern Michigan? Okay.
No, I got the grant from Mid-State Health Network. But we do work in partnership with our police departments and have all of the Hope Net handcuffs, participating police department arm patches listed on our back door, and they oftentimes will come out to events or invite us to events, and we'll be adjacent to them. But it wasn't through Michigan State Police, it was through Mid-State.
Yeah, our group in Traverse City partners with the state police that got the grant for the in plain sight trailer. And it has been at several FAN events that I have gone and spoken at.
Got it. So there might be some data there.
Really yeah, I'd like to be interested in that too, because we were talking about doing like a mod bedroom, but not in like a trailer type thing where you could take it around to places. We were just going to kind of do one to set it up, but I like that idea and would like to, see if this is something that would be covered or not.
Yeah, so go ahead, Amy.
Okay, thanks.
Thank you.
So I'm Amy Moore. I am a contractor with MDHHS, and I work for the Injury and Violence Prevention section at the state of Michigan. So I'm a grant manager for the Prevention Network contract that we have through MODA. So welcome, everybody. A couple things when I'm thinking about the current conversation about hidden in plain sight. some of the concerns I think that we're seeing with overdose prevention right now is the impact that COVID is having on us. So the first thing I thought you were going to say when you talked about the trailer was some other trainings that I've done, which are online trainings, you know, where you might see an image of a teen's bedroom and then, you know, you can click on things or something like that. So maybe not having it be a physical place, I could see that. And then I also personally am, I'm through McBath, I am a certified prevention specialist. And I know that we can look at some of our local data and see some of the gaps between what parents and teens, the misperceptions. So we can look at some of the youth data and see some of the misperceptions. So the concept about hidden in plain sight, what's the action or what's the activity that we're looking at from the family with this information, or with, you know, these, parents or caregivers or grandparents or people in the community. So I would just maybe take that link a little further, not necessarily does having a trailer with stuff on it work, but can this be used to engage a conversation or have kids go to a community center or join in scouting or some of those other prevention activities that you specifically know you have in your community that you're trying to boost up so that kids have positive interactions, positive recreation opportunities. And because of COVID, there's so many options that have come off the table. We don't have these protective factors in our community right now. So I would just encourage thinking about kind of a new way that we might be doing business.
We actually are looking at how we could do a virtual tour and have that available for virtual meetings, like with community groups and that type of thing, until we get back to our regular business. One of the things that I found great benefit in it, I'm a mom of a daughter who's now a little over 4 years in recovery from an IV heroin battle. And when she overdosed on heroin in 2018, the things that we had seen in her room, we had no idea what they were. No idea that they were drug related. We were completely in the dark about what we were seeing. So my daughter did overdose, and there were signs that she probably was going to overdose that I as a parent had missed. This trailer to me gives people a heads up of, especially young people, that there may be signs and symptoms that you just are not going to catch without the education. So I know personally from my experience, and I know it's just anecdotal, but there is a strong link to the things that I see in that bedroom that had I known, I would have been more prepared to help her daughter.
This is John Cronick. So we have a youth leadership program, and they're getting trained through CADCA and so forth. And I'm trying to think are these grants applicable to building the infrastructure of this youth thing? Obviously, it's not the whole program, but it's building on something that is research-based. CADCA's promoting it. Would that be a viable expense?
I'm not and maybe Amy can answer that a little bit more, but I'm not sure if it would be covered in it. Amy?
Oh, sorry. I would say definitely, because you're just expanding what research is already showing. And I mean, we're, you know, so and then that 1,000 to 40,000, it's not that much money, but if it gives you a leg up, or if you can, you know, maybe make this information a little bit more accessible, or, you know, these are the next steps that we need to take to build towards that program. I think that that's what the intention of the mini grant, right? It's not to fund the whole thing. It's to get what's that next step that your community needs. It might be COVID related, it might not. It might just be, you know, getting parents to understand that they need to build relationships with their kids, or maybe you drive them towards a youth prevention group, or so it can be a tool that promotes prevention in a concrete way.
Cool. So that it would include bringing in a well-known speaker to help the kids understand the process, the SPIF process, etc.
Sure.
Okay.
Thank you
much.
And I saw in the chat that we can bill for the virtual technology platform for something that's an evidence-based project. So if the trailer, if that's appropriate, Amy, I just wanted to confirm that virtual walkthrough would be something that could be funded with the mini grant.
Right. Well, maybe we could back up a step and just talk a little bit about the Prevention Network mini grants, because so I've worked in drug prevention in Michigan for 30 years. I had been on a previous Prevention Network mini grant committee, and my experience with that service was that Prevention Network always wants to support the project you're doing. And so if it's not like a stamped yes or no, it's, hey, thanks for the idea. How can we make this more research-based? Are there similar programs that we know work? Is this building, like John Cronick mentioned, is this building on something we know works, and we're trying to engage a new population into that strategy? So of course, we're looking at data, looking at research, and then looking at your community. What's that one next step that needs to happen to connect people either for prevention or treatment and prevent overdose deaths? So I guess I'm not giving a concrete answer, but I would say we want the money to go out, and if you see a value in that in your community, when you apply for the mini grant, you're going to get as much support so that we can say yes and get that project rolling for you, or help support you redirect. Oh, these other communities are doing these 5 things. Would you be interested in any of those?
Thank you for clearing that up, Amy. And we'll have a small narrative on the grant application. So like Lori, if you mentioned before the hidden insight plane trailers, you could definitely write everything in there, and what you anticipate and how you think it would build capacity for your organization and stuff like that. And then once we get that application and approve it and stuff, we'll work with it on you. Like I said, they're all ideas for the allowable on our website. They're all just ideas. So feel free to build on those and just write in your grant application what you're thinking about doing or what you want to be doing, and then we'll help you guys throughout the way achieve those goals.
Thank you.
Thanks.
Laura, I'm wondering if the under frequently asked questions, you sent the preventionnetwork.org/MODA link, and I have that pulled up. I'm wondering about maybe just I could list a couple things off this list, or maybe just encourage folks. Okay.
That sounds great. Thank you.
So you heard that Charla Burnett at OT Consultancy, they are offering management, website, and branding services. You can also get help with finances, tax paperwork, financial management systems. So that's like enhancing the efficacy of the agency that you're with. But then we also have things like increased collaboration between community organizers, libraries, EMS, police, encouraging exit strategies when people transition from jail into the community for recovery, promoting or educating about the 911 Good Samaritan laws. I've heard a lot of comments about that these are inconsistently enforced throughout Michigan. Encouraging MAT in the criminal justice setting and upon release from prison or jail. Academic detailing, which is educating prescribers. Sorry, there's a big truck going by my house. Eliminating prior authorization requirements for medications for opioid use disorder. So I heard already on the call that people are allowed to do a lot more things remotely or outside. How long will this go on? Are we going to have to go back? Because I noticed that with some people, a telephone call for recovery supports is good. Is there a way for us to advocate that those stay in place, that we can still do telephonic support? Supporting sober living, home, transportation, trauma-informed care trainings for community, individual, or work teams, trauma-informed agency assessment, drug-endangered children. We now have a statewide office of drug-endangered children within Michigan State. That's brand new. We are very blessed. And I know from myself working in the community that we used to have a lot of scattered drug-endangered children pieces, and now there's an effort within the state to try to coordinate all that. Michigan ACE initiative or trainings, assess and improve. One of the things we did when I was in local public health was we did some walking sides of clients, and we walked beside clients to see where the ball gets dropped, and just helped agencies understand what that was like. So that takes time, that takes resources, that takes interaction, and then to solve that problem, there's more effort. And effort means that somebody's got to be paid to do it, and that's more things that this money could go towards. Just promoting the use of human services across communities. I know some people are doing some visual representation of maps with human services. That's something that could happen. And then just, you know, having some hyper-inclusive or low barrier supports, sober scholarships, and then Hara also mentioned Seeking Safety, which is a workbook program. It's a research-based protocol. And I know that some of the SAMHSA grantees had been funded to do this, and then that was dropped for some people. And so I just want to bring that back. When I used it in local public health, it was very effective because it's offered in most prisons in Michigan. So when you have someone that's recently released, if they hear the word Seeking Safety, they have usually what my experience has been, that there's a positive regard for that program. And that's a program that is for people that have a history of trauma, PTSD, and substance use. So those are just things that we came up with, but maybe that helps with a little bit more information, thinking about more concrete ways. It's something that's on the list that cannot be purchased but is available is naloxone, because agencies, I don't know if you're aware of this, but agencies can order naloxone for free from the michigan.gov/opioids website. You can get cases in boxes of 12 naloxone. For an agency, you can get multiple boxes of 12. And so naloxone is available. So if you wanted to do naloxone training or partner with your naloxone training partners, or think about an add-on to the naloxone training or your syringe service programming, whatever's happening in your community, this is about that one next thing. What's the thing you wish you could have done, but you didn't have the resources? Thank you.
Thank you, Amy.
I have a question regarding academic detailing. Would all of the academic detailing need to be completed by that August 31st date, or is there a way that we could kind of front load any money allocated for that so we'd have a longer window to have those interactions?
So from what I know is that it has to be spent by then. So we would have to front load it all and kind of get all of our contracts and everything done before then. And then they would have the money in, you guys would have the contracts for the next year or whatever you guys decide to do with them. But we would be paying them up front and front loading them all of that money ahead of time so that it would be spent by August 31st, so we could get receipts and everything to the state by then. But you would still have your programming with them going on with your contract for the next year or so, or however you plan to do it.
This is Jeff from Connection. Just wondering, one of the things that we're just starting to kind of kick around is a partnership with the health department to kind of target where we're doing our Narcan trainings by looking at EMS and overdose runs in Wayne County. Could they support like some kind of coordinated effort with this? I'm assuming this grant to improve our service delivery of Narcan training. Let us kind of see exactly where people are overdosing a lot, say in the past month, and then targeting trainings in that area. That'd be allowable.
Yeah, we would. That would be an allowable expenses, is to collaborate with your EMS, police department, hospitals, and things like that to do that. Yep, that would be an allowable expense.
Okay, thank you.
Mr. Martinez, the OD MAP program has a contract with Wayne County, and all of that data is gathered there into one amazing spot, and you can pull that daily. It's in real time. So that gives you a really good snapshot, even if you wanted to go back a month, 2 months, 6 months to create your evidence base. The OD MAP program through the DEA is amazing.
Thank you.
Sounds
good.
Hi, this is Kathy Wortham from Arbor Circle. I may have missed it at the beginning when you were talking about the dates, that it was due. I came in when you were saying it was due on the 21st of June.
Yeah, so we'll have 3 different rolling application dates where we'll review the grant. So the first round it starts on the 12th, which is this Friday, and then it'll end on the 21st. So that'll be the first round of applications. You guys can go ahead and submit, and then we'll review the first round and then make distributions of funds for the first round, and then we'll re-review them in July, make distributions, and then do it again in August.
So if you're doing them again in August, how would you get that turned around in time?
Yep,
So spend it by August.
Yeah, it'll be a lot of front loading again, making sure that if we're gonna do things with you guys, that we're gonna get them paid out before August 31st, get everything done, and make sure we'll be helping you along the way. Kind of like I mentioned before, I don't know if you're present, but we'll be here for technical assistance throughout it all. So once you guys get that money, we'll be here helping you guys figure out ways to get it spent before August 31st, even if you're going to get the last round of applications. I know it kind of sounds scary, and it is scary because it's such a short amount of time, but we're here and we have your back throughout it all. And I just want to reiterate that because you guys won't just be getting the money and then asked to just run around and figure it out yourselves. We'll be here throughout the whole process to help you because it's so fast and it's so short, and we understand the hecticness behind it. So don't feel like you'll be alone in any of it.
Okay. Maybe I missed that. As far as the turnaround and on the responses, if it's due on the 21st of June, when would we learn about the results, whether it was awarded?
So we'll have the board, so we'll have a grant review committee review the applications first, and then it'll get sent to our prevention network board. And I can't remember the exact date, and maybe Louise can chime in for the exact date they'll review, and then we'll be funding them.
Okay. So we don't know exact deadline of when we would get award notice or not.
Yeah.
It might be a couple weeks or so.
Sorry, I can jump in a little bit. So for the first round, we have extended it, our deadlines, just to give you a little bit more time to complete the application. But I still expect the board will, let's see, the grant review committee is going to meet on June 23rd. And then the board will be voting on those recommendations that come out of that review committee shortly after. And you should be able to hear back once we know and the board has a final determination. We can turn around and share that information with you pretty immediately. So I would expect within that first week of July for that first round.
Okay. This is Lisa Faulkner.
Oh, go ahead.
Okay, sorry. So I thought I heard early on that when somebody asked about the global amount of money that's being made available was 200,000. Was that correct?
Yeah, I think it's approximately around then. Yep.
Okay, so I guess I'm just trying to get a handle on this because let's say in this first round of applications, you get a good response, and if my math is correct, let's say 5 organizations say they want $40,000, that means the money is spent. So there's a lot of people here, and I'm just thinking about, time and capacity and return on that time. So can you give us an idea, like, are you going to throw up a red flag and say the money is spent at a certain point?
So once all the money gets spent, we will definitely let you know, and we wouldn't keep going on with the process. I'm not sure that we'll be expecting to give away $40,000 to each 5 applicants or anything like that. It probably will be smaller amounts, but and like we said, we're not expecting to build anything from the ground up with this money, but just building capacity and extending services that you guys already provide. So valid concerns, and thank you for bringing them up, because I definitely understand where you're coming from. But like I said, I don't think we'll be front loading all of that money right away, and I wouldn't expect for the $200,000 to get spent for the first round. And even if we do get all the applications, we might roll some over till the next month, depending on things like that. So I hope that kind of clears up your answers. And I'm sorry I can't give you 100% of an answer of what funding exactly is going to look like. But if you guys are, you know, giving us an estimate of what you think it is, and it's around $40,000, please go ahead and do that. I don't want you guys to change that because you feel like it's not gonna, but I can't guarantee that you would be getting the full 40,000. But definitely, you know, go through the grant, and whatever you think your projected expenses are, please list them as you feel they are, and we will review them with the board and stuff to figure it out. But and like I said, once that money is spent, we will definitely let you guys know.
This is good afternoon. This is Mona from Access. I'm sorry, I kind of joined like maybe, I don't know, a few minutes late. I couldn't get my I couldn't hear you guys for a while. I'm like just trying to make sure I didn't miss something. So the last time I spoke to you guys, we had an assessment. After my assessment, I didn't hear anything else except for the invitation to this town hall. Did I miss something between?
Nope, you're just on par. So we just finished the assessments last week. And so that's a majority of you guys have gone through these assessments with us, and those are what we will use to guide the grant application. So one of the grant application will be open on Friday, starting Friday for a week. So until the 21st is the deadline for the first round of applications.
So if you haven't gone through the assessment process,
I was watching mouths move, but no voices. So I was like, I don't know what they're saying.
Thank you.
Okay, awesome. Thank you.
No problem.
So if we have not gone through the assessment process yet, we wouldn't be eligible for the mini grant.
You would still be eligible for the mini grant. The assessment will just help us get a better understanding of your organization, the current capacity that you guys hold, what you guys could build. And if you didn't get to do the assessment with us, please reach out to us and we can schedule a time for us to go through it with you separately if you still want to.
Yes.
Yeah, of course. If you want to send your email in the chat, I can follow up with you after.
Okay.
You're welcome. Thank you.
And one other question I had was, so if you had said you might roll over some to the next round. If we were not selected in the first round, should we go ahead and just automatically reapply if we were still interested, or get any feedback on our
I don't think you would have to reapply, but we would just move your, I'm not sure this will be my first round, so maybe Amy and Louise can help me in. If we don't, Amy, thank you.
So I kind of had brought up in the past what Prevention Network had done with mini grants. And so the concept is that if you're an agency that's engaged in this work, the goal is to help you be successful. And that can be an agency, as successful as an agency, or that the work you're doing can become either more targeted or give us better outcomes or measure things or just, you know, do something that you haven't been able to do as an agency. So my expectation is that it wouldn't be that your application comes in and we would deny it. We would work with you and say, could we look at some more research-based strategies? Are there other ways to approach this? Because of the assessments, now we know there's 4 other people doing exactly the same job as you. How can you make your agency shine and be a little different? So it would be more of an engagement. So once you're engaged, we hope that we could work together to fund a successful program. I know this is a very short time period. Thank you for being patient. And but also the mini grant is not like a big RFP, right? It's a mini grant. Here's a couple ideas that these are all the right next steps for us to take to prevent overdose assessment in our community, and then we work with you from there.
To follow up with what Amy said, because I think Amy said it so well, but to add a little bit to that, the mini grant application, we wrote it and we meant for it to be something that if you've never written a grant before, this is definitely a good grant to apply for, because we'll work with you throughout the process in applying application submitted, as well as spending the funds in the final report. This is not something where we're just sending it out. And a part of this is in what we've designed the application to make it as easy and helpful for you in walking through this process, especially if it's your first time.
Yeah, thank you, Louise and Amy, for both bringing those up. And like I said, the assessment isn't required, but just going through the assessment with us, it'll be easier for us to pinpoint what you guys want to build capacity on, and then yourself too. Every time I do an assessment, it's great to see reflection within the organization and just see what they want to do to improve their organization. So going through that and figuring that out too will be really helpful. So thank you both for clearing those up.
Thank you.
Okay. Do we have any other questions while we're still on the call?
Excuse me, this is Lydia. Hello?
Hi, Lydia.
Hi. I was wondering if would it be a conflict if like two of your organizations work together? Or are you just wanting to do an individual project per organization?
Yeah, I don't think that would be a problem. And I am looking at, yeah, I don't think it would be a problem. And I'm looking at Louise agreeing. So I think that you guys could definitely collaborate, especially if you guys are in the same area or doing the same work to bring this on and get the money together.
Okay, thank you.
No problem. Thank you for asking.
Well, once we start writing for this, can we contact you if we have specific questions?
Of course. Please feel free to do that. Yes, of course. And like Louise mentioned at the beginning, I love this grant application because it's like a job application. It's just like fill in the blank. It's a little bit of narrative because we need to understand what you guys are doing, but it's like 2 to 3 sentences for each question, and you guys won't have to sit there and write stories for me. And you guys know that grant applications can be kind of scary sometimes, and we're hoping that that's not what it will be. But of course, we will be here for technical assistance at any point. Just shoot us an email, and we'll be happy to help you with any questions that you have. And I also want to introduce Charla, who's on the call really quick, if we have a second to do that really quick. Charla is who we've teamed up with at OT Consultancy, and she's kind of who will be helping you guys with technical assistance hours. So if you want to just jump in and introduce yourself, Charla.
Yeah, hi, my name is Charla Burnett. I'm originally from Lansing. I just came back a year ago to have my son, Adam, and I have been working with nonprofits and international organizations for 15 years. I used to work for the United Nations. I used to work with capacity building for organizations in the West Bank and in West Africa. And I came back to do my PhD in governance and institutionalism. And when moving back here, I started my own consultancy with my husband. Now we have 3 other consultants who work on organizational capacity in some way, either technical, financial. We also have a political canvassing wing as well. And I personally specialize in strategic planning, facilitation, and technology, specifically the use of software to help scale organization missions. So if you are trying to brainstorm some ways that you might be able to use the grant, you're welcome to make an appointment with me or with Hara. We have a full list of different services that OT provides that are allowed underneath the mini grant. I know I've talked to some of you because I did the organizational capacity assessment with you. And then we have another one of our consultants. Her name is Katie. She owns a very successful business that now has, I think, 7 childcare branches across Michigan, and now does financial literacy coaching. She's here to help you do any type of financial projections or budgeting around the grant. So if you need support, what's great is there's 2 links, and I believe they already sent out the email. And you can go ahead and schedule those appointments when you can schedule one or one with each of us. It doesn't matter. We have set aside consultation hours for all of you. But I'm the one who kind of hosts the MODA community dashboard, so you'll be onboarded soon. We're really hoping to create a really unique space for overdose prevention organizations so that you guys can find each other quickly and effectively, build collaborative work with one another, and then it also allows us to collect data on what type of organization you are, where you're located, and who's on your team, so that we can better communicate with you as we help with the prevention network, hopefully past this grant.
Thank you, Charla.
Thank you.
Yep. So like Charla mentioned, those will be free technical assistance hours. So if you guys are getting our email campaigns, and we'll also have this on our website to schedule some hours with her to do some technical assistance or with Katie. And those are free for you guys. So please use that to your advantage.
So where is the website? It's going to be sent to our email, the information?
Everything is available on our website. Are you getting our email campaigns?
No.
Okay. Can you share your email in the chat, and I will make sure to add you to our constant contact list. And then I will also send you a personal email with links.
You have my email as my registered name, lydiareyesflores@gmail.com.
And for those of you who aren't receiving the email but may have already shared your contact information, check your spam or junk mail because it goes through constant contact and sometimes it can stuck in junk mail.
Okay.
Yeah, other than that, it's just on the preventionnetwork.com/MODA, and that's in the chat that I shared before, and I'll share it again really quick for you guys. And that's where we put a lot of our information is we just update our website. And then if you guys want to all hop on that MODA.community, that's where you'll create an account, and that's where you'll get started to do the grant application. So if you guys just want to make sure that we're doing that sometime this week, the grant application will be open on Friday for you guys, and then it will be open for questions whenever you guys have them.
Thank you.
All right, if nobody else has any closing questions, I think we can end the meeting here. I just want to thank you all for coming out and talking to us virtually and asking those questions and getting this ball rolling on this grant. And I also want to say thank you guys for being patient with us. This grant will be moving pretty quickly, but we'll be here throughout the whole process. So thank you guys again.
Thank you.
Question.
You're welcome.
Yep, Amy, really quick.
I wanted to hear about the assessments. I really haven't heard.
Yeah.
So I don't know if people want to stay on, maybe we can just hear like a little off the top of your head, maybe tell us about the organizations and what you found out, because I know you've got to write the report. So I'm kind of anxious to hear what you found out when you contacted the 48 agencies.
Yeah, so it was me, Charla, and then Nadia as well. So we took on those assessments these last 3 weeks, and it was such a success. It was so amazing to talk to all the different organizations and see what you guys are doing individually. And then kind of like I mentioned before, that reflection aspect of just asking you guys questions and seeing organizations' face light up and be like, oh, well, we could do that, or I want to improve on this, or I think we could make that document and put that in our business plan. So that was really amazing just to hear from you guys. And then I mean, obviously through COVID-19, it's been really weird. So it's just been great to see how you guys are still being preventionists despite everything. And I want to open up the floor to you guys and just if you guys could give us some feedback on how you guys thought the assessment went. I personally think they went great. And I want to thank you guys all for taking an hour each or even more to do that with us. Thank you.
And organizing together is actually going to be doing the assessment. So in the next couple of weeks, all of the organizations who participated will receive a score in each of the 5 different aspects of organizational capacity. I will also be reviewing all of the notes that Hara and Nadia or myself took over the last few weeks and make sure that I add some notes that are specific to your organization and ways in which I think you could build out capacity. So it'll be very individualized. And then you will receive that report and you can do whatever you want. You can make it public, you can share it with your staff or your membership, you can keep it private, whatever you feel comfortable with. But we're going to be anonymizing that information and creating reports that will be publicly available. First, we'll send it out to you. It should be done by the end of June. So you'll have a week in early July to be able to submit any feedback, anything that you would like changes made, or maybe some additional comments before we open that up and publish that publicly. I can tell you right off the top, the lowest score was 40%, the median score was 79%, and the highest score was 99%. I can tell right now the lowest scores had to do with questions such as budgeting for a data management system. This is something that I keep seeing over and over again, is that there are not a lot of tailored data management systems for you. And when I talk about it that way, it's not necessarily that there isn't a lot of databases out there for you. There's loads of databases with all different types of data. But what I'm hearing from the organizations that we're assessing is you don't have the tools you don't have the tools to adequately monitor and evaluate your own programs. A lot of the software that's available right now is very standard. It doesn't really provide you with the indicators that are important to your organizations. So going forward, I'm probably going to suggest to the state that they provide some funding to create a monitor and evaluation system that's more in tune with your guys' specific needs on the ground. Overall, there's also there's an issue about adequate capital and sustaining that capital. A lot of the smaller organizations do not have funding for 3 years. They're often on a year-to-year basis, and unfortunately, this really inhibits scaling your organization when you don't know where you're going to get funding in the future. And obviously, this is the same old story. This is literally probably in every report I've ever filed with the federal government for USAID and here in the United States, is that having things set up this way it doesn't work. It doesn't work for the nonprofit world, and we really need to figure out a better strategy of ensuring that we know where the money is going to come from and can adequately plan and scale all the great programming that you're doing. Another low score question was on organizational capacity for the maintenance of a performance data management system. Who has the capacity to pay a staff member just to do monitoring and evaluation for your programming? Unfortunately, M&E is usually a post-thought. Not many organizations are trained to embed that into their budget, nor is there a lot of incentive to do that. Because then you're taking money away from the programs and the people that you're trying to help in the community. So unfortunately, I think that's going to have to take a lot of educating both the grantors and the funders and people within the organizations to understand and see the value of performance monitoring. So hopefully we can, now that we have empirical evidence of some of these things, we can put those into a report and submit them to the state and to the CDC.
Thank you, Charla.
No problem.
Yeah, so I think the assessments went great, and I'm excited to get that that report from Charla and send it up to you guys for feedback, and that I think that'll help you guys as well look over that and kind of see what targets you guys want to hit too, because I know those are really personal, and I want to thank you guys for going through those with us and sharing that personal information. I know it can be quite emotional to talk about things like funding and things like that, especially when sometimes budgets are tight and things. So I appreciate you guys going through that and being honest and going through that with us.
Yeah, no, it can feel, when you have to admit that your organization has things that it needs to be working on, it can feel a little odd telling someone, specifically someone who's giving out money, that, you know, your organization isn't the best at everything. So we really, really appreciate your honest feedback in that assessment, and we really hope that we could petition the state and the CDC to fix some of these issues. Is our overall goal. So we really appreciate you doing that.
All right. Well, thank you all again for joining our call today. I had a great time and I appreciate it. We'll have another couple of town halls coming up in the next couple of months, at the end of this month too. And those will be more focused on our dashboard and getting you guys on there and what you guys can do to collaborate on the dashboard. So if you guys have any personal questions, I'll go ahead and send my email in the chat. Please feel free to email me any questions that you guys have. Other than that, I hope you guys have a wonderful day.
Thank you.
Thank you.
Thank you. You do the same.
Thanks for your time.
Bye, everyone.
Bye.
Bye.
Appreciate the opportunity. Appreciate it.
Bye.